Welcome back to Preserve Health Talks. I'm your host, Dr. Ira Pearlstine, and my co-host, Lee, again, is away on vacation. And she's going to miss a really great show because today I'm joined by attorney and now entrepreneur, Guy Rubin, director and CEO of a new company, Omega Reboot. And together with his daughter, Aubrey Rubin, who's the creative director, who is off screen right now and watching us film this show, they're launching a breakthrough product called Omega-8+, which is a nutrition bar built around the powerful benefits of omega-3 fatty acids, specifically DHA and EPA. And Guy's journey with this product is so fascinating because it began in the south of France, where he had a chance meeting with a digestive health specialist who specializes in the benefits of omega-3. And that encounter inspired the development of this bar, the Omega-8+ bar. And today we're going to explore the story, the science, and the future of his company, Omega Reboot. Welcome, Guy, to our show.
Thank you. And thank you for having me.
Oh, yeah, it's just a pleasure having you here. And the audience can't wait to hear about your product and perhaps test it out in the future. Two questions to start off with. How did you first come up with the concept of Omega-8 bar? And can you tell us more about your serendipitous, I guess it was a serendipitous meeting in the south of France with the digestive health specialist? And what struck you most about that conversation, and how did you get all this going?
Sure. Well, my wife and I, we have gone to Provence for the last 4 years. I'm kind of at the end of my legal career after 37 years.
Congratulations.
Thank you very much. I'm a recovering lawyer, I think, now. But 37 years of litigation takes its toll. And so, basically had no idea or plan to get into another business.
Okay.
Just wanted, to enjoy my life after so much hard work. And so this summer, two summers ago, it was just a chance meeting with a biologist and a digestive health expert who has devoted his entire life to naturally curing digestive problems like irritable bowel and other ailments of the stomach and the digestive system. And we became friends, and our wives became friends, and so we spent almost the entire month, going to restaurants and sharing good bottles of wine. And during that time, I learned about his background, and I was quite amazed about what he had accomplished in terms of working with omega-3. I didn't know anything about omega-3, but he helped me understand, and I'm a very curious person. So
Lifelong learner.
I listened and I learned, and together we came up with this concept, which is appropriate for America, not so much appropriate for France, where he was selling a different kind of product for that culture. But in our culture, which is more fast-paced and on the go, we together developed a product that merges two very popular categories, which is bars. And if you walk into any store, you'll see hundreds of bars on an aisle, everything from candy bars to nutrition bars, all different kinds of healthy snacks and some not so healthy snacks. And then if you go on another aisle in a store, drugstore, Publix, wherever, you'll see supplements, and you'll see omega-3 in the form of fish oil. And it's, about 20 or 30 or 40 different products. But no one has merged the two, omega-3 and a bar. And we've come up with the first of its kind in this country.
Yeah, and people just don't like taking pills. Do I have to take another pill? And if the bar can deliver the same fish oil product. And I hate to even call it fish oil because truly it comes from plankton. And plankton is eaten by fish. And it's the plankton that does this. And this bar that contains the omega-3, both the DHAs and the EPAs, the different omega-3 fatty acids, it's all naturally derived from plants, correct?
Exactly. So that's the huge differentiator, is that $3 to $4 billion of fish oil is sold to get the omega-3. Doctors recommend it. All kinds of medical professionals recommend it, and for good reason, because the omega-3, over 20 years of clinical studies and trials, has conclusively shown that it has huge benefits in all different processes and to make us more disease resistant. But what we realized when we were putting this together is that the fish oil pills only exist because traditionally the only way to get omega-3 was to kill fish which eat microalgae. But if you go to the source, right to the microalgae, which is what we did, you don't need to kill fish, which has two great benefits for our world. Number one, it's plant-based, and it is much more easily digested in the human body when you're on a plant diet. And number two, we're not depleting our oceans of thousands of metric tons of small fish, which are in the chain of life for larger fish. And it's a serious problem, but our product can be part of the solution. And that's really what we're all about, is providing solutions. And the other great part of what we're doing is we're verifying the results. Our program, which is to sell these bars in a quantity sufficient to take your blood up to a therapeutic level, which is 8%. There's a 1 drop of blood test, which you can take at home. And in a few days, you know what your omega level is. It's called the omega-3 index. And most Americans are between 4 and 5%. Therapeutic levels are over 8%. And so our product, together with this testing, will allow our users, our customers, to see where they start consuming our bars, and then test periodically over 30 and 60 days to see for themselves how their own blood becomes better and more therapeutic, and then they feel the benefits in the real world.
So you have this concept, and you meet this great scientist, and you get this together. So you're going from concept to finished product. What were your largest hurdles?
Wow. So it's all difficult, and this is a completely new world for me, but as they say, you start drinking from a fire hose is what you have to do if you're really committed, and we are. So the biggest hurdles were, number one, we needed to prove that this product that is new to the market and unique in the world actually works. So we went to the leading testing lab for omegas in the world, the Fatty Acid Research Institute, and we conducted a clinical trial over 90 days. And really remarkably, it turns out that the process that we have come up with, which is to infuse the bar with other ingredients that protect the omega-3, which is the active ingredient that you really want in your blood. When you put pills in your stomach, the digestive process churns and oxidizes and depletes the effectiveness of the omega-3. But when you combine it into a food product, and especially with certain very unique antioxidant ingredients, it protects the omega-3 in the stomach so that when it gets to the lower intestine, where the absorption into the blood takes place, the omega-3 is there and it's available to your blood. So the clinical trial was difficult to to get through because you've got to recruit people and you've got to make sure that they're compliant, and that's a whole process. So that's one layer. And the other layer is getting the people who can actually execute this on a national scale. And we successfully recruited about 10 people, executives in these spaces, bar manufacturing, medical, Omega experts. And this team has worked night and day to bring us to a point, really in about 9 months. We thought it would take 2 years, but we're just about ready to launch the product because the clinical trials were successful. We're bringing manufacturing over to the United States from France, even though we're keeping this French beautiful creation. The bar is actually a chocolate brownie, not American kinds of chocolate like milk chocolate, but cacao.
Well, I've tried the bar, and I have to tell you, it tastes great. It doesn't have a fishy taste at all, which
It shouldn't.
It shouldn't. Because it's
not fish.
It's not fish. It's plant-based, but just get the same ingredients. So because we are a medical and a science show as well, I just want to let the audience know the difference. There's Omega-3, which is great for both vascular health and brain health. There is Omega-6 and Omega-9. Forget Omega-6 and Omega-9. They're actually not beneficial for you. It's the Omega-3. Now, Omega-3 can be divided into two different products, EPA and DHA. And that is only an acronym, DHA and EPA, for the chemical formula, the chemical structure of where the carbon chain is on this long molecule. Let's talk about DHA and EPA because your bar has both. What are the benefits of DHA and what are the benefits of EPA, and how do you incorporate that, or how did you incorporate that into your bar?
Okay. So first of all, let me just admit I'm not a scientist in the medical sense. I do follow the scientific method.
Well, you're doing pretty well.
As a trial lawyer. And I've had to do the deep dive and learn a lot of this. So this is not based upon what my training is. We're science-based. Everything we do follows the science. And so what I'm going to talk about in terms of DHA and EPA are based upon 20 years and 20,000 studies that have been published. So DHA is actually an element that is found in our brain. As much as 25% of our gray matter, our brain matter, is DHA.
Cognitive health and mental health.
Exactly. So when you have a perfusion of DHA in your red blood cells, that's the testing, which is indicative of every cell in your body. So when you have every cell in your body with this therapeutic percentage, 8 or more, of DHA or EPA in your blood, all parts of your body are improved, but the DHA in particular improves in cognitive, memory, and the clinical studies show that it is beneficial to avoid dementia and Alzheimer's. There are new studies coming out all the time. There's really been an explosion of the science. There are studies that are emerging in real time which shows that DHA supplementation can even help in sports with micro concussions, rugby, soccer, football, all these contact sports. You don't have to have a concussion to have some trauma to the brain. All of these little micro hits that the body takes creates an overall cascade during your life. But when you have this additional DHA, it's protection against those damages. So DHA is highly beneficial. The most important thing, though, is that DHA moves the omega-3 index above 8 faster than anything else. And all of the scientific studies are correlated to more than 8% to get not only the cognitive and this disease protection of the brain system and neurological system, but also heart, cardiovascular disease problems, We all hear about HDL and LDL. The more of these omega-3s, and this is more focused on the EPA, for the longest time, people have been looking at this ratio between HDL and LDL, but now the science is emerging to show that it's the bad LDL that really is what's important. And the more EPA you have, the less bad LDL you will have, because it's an oil and it penetrates your cells. And so the LDL becomes more flexible. It doesn't break off and clot.
Exactly. And EPA also lowers triglycerides, and triglycerides and HDL are somewhat inversely proportional. So if your triglycerides go down with EPA, your HDL, or the good cholesterol, the carrier of the cholesterol back to the liver for processing, goes up. HDL goes up, triglycerides go down. So it's a perfect combination.
And this is why, again, you don't have to take it from me. This is what the studies show, is that when you have this therapeutic level, most people have less need for statins, less need for high blood pressure medication, less need for medications directed at triglycerides.
So when do you plan to launch the bar?
So we are feverishly working on all kinds of different aspects, and there's a lot of both regulatory and practical considerations. It looks like we're going to launch right around the first of the year.
That's great. And will it be sold in stores, or is it mail order or Amazon? How are you going to do it?
It will not be in stores, at least not for the first couple of years. That would raise the price of the program. And so we're not selling by the bar. This is a program. It will be at least a 60-day program where a person commits to doing something for their future, which is to change their blood, change their health, change their trajectory of their health span and their longevity. And so with that program, our consumers, our customers will get the bars and will get the testing so that you can create your baseline. Where are we before we start taking this product? And then where are we after 30 days? All supplements should do this. None do it. We'll be the first.
Well, hopefully, if you're a patient of mine or Leah's at Preserve Health, you're going to have an in on getting these bars. And
yeah, we'll make sure that, and that brings up, yes, we are going to be distributing through practitioners. These are the best people to understand the science, to relate that in a way that patients will accept, because patients trust their doctors, and doctors are, opening their eyes about natural cures.
Sure.
and less about pharma.
Sure.
I think that there is a widespread cynicism and skepticism about pharma and the side effects, some known and some unknown. This is a purely natural product.
And if I can get what I need out of a bar and eliminate a pill, that's a good thing. Hey, we're running out of time. I'd love to have you back on the show. This is Preserve Health Talks. I'm talking to Guy Rubin, the founder of this new company. And it's just going to be a great thing. Omega Reboot, thank you so much for being on the show today. We look forward to seeing you in the future. And thank you for joining us for another episode of Preserve Health Talks.